In a year where we all have been confronted with both historical and unprecedented challenges, child welfare needs your support, now more than ever, in ensuring children's safety and well-being. Did you know that child abuse is common, with a lifetime risk of about 25%? This makes child abuse more likely to occur in a child's lifetime than common childhood diseases, such as asthma. This is a problem that cannot be overlooked. Historically, educational personnel have made up about 27% of the reports received by Child Protective Services. During the COVID-19 pandemic, schools have averaged only 7% of the reports received by Child Protective Services. With the reduced reporting by our schools, Wake County Child Welfare needs medical personnel to be engaged, to recognize the signs of child abuse and neglect, and to report it. The words abuse and neglect are often used interchangeably. However, each type of maltreatment is distinct. Child abuse is the intentional maltreatment of a child and can be physical, emotional, or sexual in nature. Child abuse may also include sex trafficking. It is important to note that warning signs may not always constitute abuse, but are good indicators that child abuse may be present. The physical abuse may include unexplained burns, bites, bruises, broken bones, and black eyes. Infants with marks or bruises. Remember, babies who don't cruise shouldn't bruise. A child who is frightened of their parents or caregivers. Known use of physical discipline or substantial threat to kill the child. Warning signs of child sexual abuse include a child who displays overt sexualized behavior or exhibits sexual knowledge that is inconsistent with their age, or a child that discloses inappropriate touches or sexual acts to a trusted adult. Warning signs of emotional abuse include visible self-inflicted injuries or suicidal ideation, a child that appears to be isolated from other family members, or a parent who speaks in an evil or demeaning way towards the child. Warning signs of sex trafficking include the presence or fear of another person, often an older male or boyfriend who appears controlling, a youth who is chronically running away or homeless, the inability or fear of social interaction, or a youth with excessive amounts of cash or prepaid cell phones. While abuse is the intentional maltreatment of a child, neglect is the failure to give a child the appropriate care they need. There are many forms of neglect. The most common are improper supervision, improper discipline, improper care, and an injurious environment. Collectively, the warning signs of neglect include a child with multiple bruises or injuries or repeated injuries, a child who acts fearful or withdrawn, a child who appears malnourished, children who are inadequately supervised or left alone for unacceptable periods of time, hazardous or unsafe living conditions, for example, substance-abusing caregivers or domestic violence in the home, or unattended and untreated health or medical concerns. If you see warning signs and suspect child abuse or neglect is occurring, you must report what you know to the County Department of Social Services. Please remember to use plain language and share your exact concerns. For example, in addition to stating the baby is failure to thrive due to the mother's noncompliance, consider reporting that the mother was referred to WIC to pick up a higher calorie formula. She missed her appointments with both WIC and the pediatrician. Without the higher calorie formula, the baby is not able to gain weight. Focus on how the parent's actions or inactions are impacting the safety, protection, and well-being of the child. What is the risk of harm if the child remains in their current environment? Do not be afraid to report. As long as you're acting in good faith, you cannot be held liable by law. If a report of child abuse or neglect is screened in for assessment, child welfare staff will respond immediately, within 24 hours, or within 72 hours, based on the reported safety and risk concerns. Even during the pandemic, Child Protective Services continues to be mandated by law to provide services to families in person. Temporarily, on March 27th, in-person visitation between parents and children in foster care was suspended. Parents and children continued to visit virtually. By May 26th, the division was able to obtain sufficient personal protective equipment for all participants, and in-person visitation resumed. Similarly, our court proceedings have resumed and are occurring both virtually and in person. Through these efforts, the impact on achieving permanency timely has been minimal. Please remember, the greatest impact of COVID-19 on our child welfare system is the lack of visibility of our most vulnerable children. If you see something, say something. We are depending on you to be our eyes and ears. As a reminder, you may contact Wake County Child Protective Services at 919-212-7990. For all emergency, after-hours, and weekend calls, please contact 911. Thank you for partnering with Child Welfare to ensure the safety, protection, and well-being of the families we serve.